drug names. Drug names. You know, I have no idea how people come up with the names for these drugs. I just don't. Because some of them make no sense, and some of them make a lot of sense. There's a PPI, proton pump inhibitor, called Prevacid, and it's designed to prevent acid from developing. Prevacid. That makes sense. But there's so many drugs that make no sense. Tylenol from acetaminophen. What do those mean? No idea. So there's three types of names. There's chemical names, generic, and brand or proprietary names. So we're going to talk about those three kind of names. The chemical name is simply a chemical designation. It actually describes the molecular structure of the active ingredient. And that's all. And I will never ask you on a test to name the chemical designation because, to be honest, I don't know. Doctors probably don't know. Patients certainly don't know. It's not really that important. The generic name is important. For example, ibuprofen. That is an important name because you can buy ibuprofen on the shelf. You will not buy 2p-isobutylphenyl propionic acid, which is the chemical name of ibuprofen. So, ibuprofen, generic name. And when you write ibuprofen for an answer, lowercase I. Generic names are not capitalized unless they, of course, start a sentence. Then anything is capitalized. But otherwise, a generic name is never capitalized. Trade name or commercial name or brand name, they're all the same meaning. Trade name, commercial name, brand name, those are going to be capitalized. So Advil, Motrin are brand names, and those will generally be followed up by an R, capital R in a circle. So it's a registered trademark. So you can say Advil or ibuprofen. It is interchangeable. I prefer the generic names because Advil and Motrin are the same thing. But if you say, I'm giving you Advil, and the person says, well, I only take Motrin at home, now you have to, just avoid that by saying ibuprofen. So the chemical name is a description of the chemical composition of the active ingredient. The generic name is given by the United States Adopted Name Council. Again, sometimes there are generic names that just make no sense. And then the trade name is the registered trademark that's registered by the company who produces that name, and it's restricted. It will be capitalized. Now, the reason why knowing generic names is so important is because the generic names sometimes have a class identifier. All ACE inhibitors will end in pril, P-R-I-L. So if you see pril, you know that it's an ACE inhibitor, always. Prazols are always going to be proton pump inhibitors. So knowing these tail ends of the names, the suffixes of the names, will frequently give you an idea of what kind of drug we're talking about. Statins, those are for cholesterol. They lower the LDL. So those are things you'll need to work on learning, because it is a shortcut to knowing what the drug is. And then there are different types of drugs that indicate or different, name suffixes that indicate how long they work. SR and XL are the big ones. SR means sustained release or slow release, and XL means extended length, not extra large. That would be your uniforms, your scrubs. XL would be extra large. But if you take like a Toprol XL, that means extended length treatment. So maybe a one time a day dose. Now, med errors. Med errors are scary. Nobody wants to make a med error. Everyone will make a med error. It's not if, it's a when. And if you talk to anybody who says they've never made a med error, they're lying. Med errors happen because we're human. It doesn't accept them. It doesn't say that it's okay. It doesn't excuse them. But it does explain why they happen. We are humans. Humans make mistakes. As long as you learn from your mistake and never repeat it, I'm not going to say okay, but if you learn from it and don't repeat it, it was probably the best lesson you could learn. Make the same mistake twice, and that's a bigger problem. Med errors happen because they could be a sound-alike or a look-alike drug. So there are medication safety standards. We always use at least two ways of identifying the patient. So make sure you have the right patient. Date of birth. I always like to say birthday. When you ask a patient, what's your birthday? Not what's your date of birth. What's your birthday? It's just easier to say. Correct time. The correct abbreviation. There's many, many rules for how to do that. Now, written prescriptions are very specific, and there are many rules about a written prescription. Only legally authorized people can write a prescription. I can't write a prescription. I can write a verbal order, but I can't write a prescription. Must be on a prescription pad. Must have specific information, such as the patient's name, the date it was written. It must have the RX symbol or the prescription symbol. That's one of the rules it must have. Name and dosage of this prescribed medication. The dispensing instructions. Administer once a day, administer every 4 hours, give with food, the number of refills that are allowed, and then the prescriber's signature, address, and phone number. And they sometimes need a DEA, Drug Enforcement Agency number. If there's a med error, what's the first thing you have to do? Notify somebody. As a student, if you make a med error, the first person you're going to tell, the very, very first person you're going to tell is your instructor. And that will probably be the hardest thing you will do that day or that year. But you have to tell the instructor first. If you tell me or whoever you have, we can help. We can't reverse the error, but we can help. We can find a way of minimizing the risk, of possibly reversing it, of protecting you from getting in further trouble. If you tell us, we can work with you. If a mistake is made and you don't tell the instructor, that tells us you're hiding something, and that is about the biggest mistake you can make. We never want this to happen. It does happen from time to time where a mistake is made and the instructor is not notified immediately. And you know what happens? We always find out. We always find out. And then bad stuff happens. So we're not going to do that. And even if it's an almost error, Like you were going to give the medication to the wrong person, but you didn't. That's still a med error. It's called a near miss. Report those near misses. Those near misses it's important to report those because sometimes there might be a facility problem that allows near misses to happen. And unless you report them, they can't gather enough information to find, to fix it. So we report full-on errors. We also report near misses. So when you get rid, when we dispose of medications, there are some medications that can be flushed down the toilet, others can't, and that also will vary based on facility. Sometimes medications will be sent back to pharmacy. Sometimes they can be thrown in. If you're at home, mix it up with kitty litter or whatever. What you're trying to do basically is make sure that nobody can divert those medications to the wrong person. So, flush it down the toilet, but then it gets into the water system. So that can be a problem. Throwing in the garbage, just tossing in the garbage, people can reach it, and people will. It is amazing what people can and have done to obtain medications. I read an article about a person working at a nursing home who was going around and peeling off the fentanyl patches off the residents' backs and then chewing them. I can't imagine that. I cannot imagine the need to do that, but they would peel them off and they would chew them to get that instant dose of fentanyl. Peeling it right off the person's skin. I'm sorry, just beyond what I need. But that's why we have to be very, very careful with how we handle all of our medications. Talking about fentanyl patches, always wear gloves when handling those because the medicine will move through your skin. Now, will it go through your palms as easily as on the back of your shoulder or whatever? No, we have tougher skin here, but some could. So you always wear gloves. Always take the old one off before putting the new one on. You'll generally initial it and date it. You'll document where you applied the patch, and then you fold the patches together, and generally most places will flush it down the toilet. Some facilities will have you throw it in the sharps container. You must take off the old one. Must. Specific example, when I was working in the ER, family members wanted to have their grandmother come in and be evaluated because she just wasn't acting right. She was just too sleepy and she wasn't interacting with people. So they brought her into our ER and were evaluating her, and on her shoulder there were 3 different patches. Now, a fentanyl patch is applied every 3 days or every 72 hours. And each of them was correctly dated every 72 hours, but they never took the old ones off. And even after 72 hours, there's still some medication in those leaching into the skin. So she was getting a lot too much medication. So make sure you take it off. All right, come back for the next section, okay? How's this going? We're having fun. 3 sections down. We're about halfway through this lecture.